Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith-Rogers. September is Suicide Prevention Month, but are the chatbots aware? Dr. Walker Tisdale III is Director of Outreach for Suicide Prevention Initiatives at Johns Hopkins University Student Services. He speaks to Dr. Josh Sharfstein about strategies to reduce suicides, the warning signs for suicide, what people can do to help others, and how we can address the potential dangers to our mental health from chatbots. Let's listen.
Dr. Walker Tisdale, thank you so much for joining me today on Public Health on Call. This is Suicide Prevention Month. Really interested in having an expert in suicide prevention come to talk. And lo and behold, one of the national experts is right here at Johns Hopkins. How are you doing today?
I'm doing well. Thank you, Josh. I am excited to be here to talk about this topic. It is very important, as you said, for Suicide Prevention Awareness Month.
And you're pretty new to Johns Hopkins.
Still very new. I'm going to claim it for a while. So I arrived here in the summer and so hit the ground running.
Tell me a little bit about your career and your work in suicide prevention over the last few years.
Absolutely. So I have had pretty quick trajectory in working with some of the most amazing professionals who are also subject matter experts in this field, starting with my time at the Centers for Disease Control and Prevention, where I worked with colleagues around grant-funded programs around suicide prevention. I was the inaugural Director of Suicide Prevention for the state of Georgia, working for the state with its 159 counties. So pretty spread out. I think I visited 103 of them while I was there. And then most recently at SAMHSA, Substance Abuse and Mental Health Services Administration.
So there is a bit of a paradox when you think about the public health approach to suicide, which is suicide is such an individual act, but public health approaches are social approaches, are collective approaches. Can you talk a little bit about what suicide prevention as a public health challenge means to you?
Absolutely. So I think it really requires us to take an all of the above approach. And for me, a public health approach really does include at the community level, at the macro societal level, and then certainly at the micro level. And we cannot really address all the different risk factors and social determinants that support people being at increased risk for suicide or even mental health crisis if we don't address it in the kind of multi-pronged way.
So let's go through each of those really briefly. When you say the social level, what's on your mind there?
So when I think about the social level or the macro level, I think about the things in society that really create pressure or exacerbate risk for people who are already vulnerable. So that could be things from changes in national programs that support housing or people's food insecurities. We think about immigration status. I think in terms of when you look at the whole perspective of a person's life, there are so many areas to where risk can be exacerbated.
And then you also mentioned the community level. What are community factors that may increase the suicide rate?
That's a big one. So that's one that I'm actually really interested in terms of there is no way that even with all of the strength and the awareness that we have in the workforce that we can do it all. So we need to enlist our partners at the community level. So that means faith leaders, that means community leaders, that means your next door neighbor, schools. We have to really arm people to, one, raise awareness. There is a good level of awareness around suicide and suicidality and suicide behaviors, but we need to arm people to how to ask questions and how to identify people at risk to connect them to care.
So in a community, you want that safety net for people. People are meeting teachers, colleagues, people at the store even, and maybe some intervention can happen there that can pull someone back from the brink.
Absolutely. Absolutely.
And then you mentioned the micro level. What do you mean by that?
So at the micro level, I'm thinking more at the interpersonal level, so one-to-one. So whether it's your intimate partner, whether it is the person that you go for primary care, what are the things that are already protective factors for people, and what are the things that are risk factors that an micro-level intervention can really support? And so let me give you an example. So for people who have well-paying jobs, who have stable housing, those are protective factors that protect them in a day-to-day, right? But when those things are missing, then there becomes a risk at the individual level. And if we don't recognize that those risks at the individual level, we could be missing risk for someone at risk for crisis or even suicidality. So even when a person goes to see their primary care physician and there's a battery of tests and screenings, I would always encourage and want people to start thinking about, in addition to asking about your blood panels, ask about their housing stability. Ask about the last time that they've been socialized with family and friends, the last time they left their community.
Got it. Since it's Suicide Prevention Month, I might ask you if people are listening to this podcast and thinking, wait a second, I know somebody who I'm worried about. What would you advise that they do?
So there's a number of things here on Johns Hopkins in particular. I would always advocate that people contact our behavioral health crisis support team for crisis situations. We also have the mental health services division, which offers individual therapy to students available through their tuition. And just in general, there's always the 988 crisis line. And 988 is one of those resources that I hope people really do share widely, because even if you are not, or the person that they know is not an imminent crisis, they can still call and get a referral. They can still call and get some information. So it doesn't have to be just about suicide, but even if someone is just thinking about it, has an ideation.
And engaging with someone, really making sure that people know that you care. Calling 988 with them is one way to show that.
Absolutely. Persuading someone to get help who's at the brink of crisis or in crisis, and you can do that a number of ways. People still have their own agency in terms of how they decide to go about it, but saying, hey, let's do this together, right? To make sure that they are actually being connected, making the phone call with someone, like you said, maybe with the speaker up so that they're doing it together, even walking someone to a counseling center or to an emergency room.
Can make all the difference.
Can make all the difference.
I want to ask you about a topic that we've gotten a lot of inquiries about, which is to do with chatbots. We read in the paper that young people are developing relationships with ChatGPT or another one of these chatbots, and those conversations can turn dark. And in some cases, we've seen printouts of where the chatbot's even encouraging someone to hurt themselves. How do you think about this challenge, which, I mean, let's be honest, was on nobody's radar screen just a few years ago?
This is really an interesting time in our human existence, because automation, technology, artificial intelligence is moving so rapidly, even more rapidly than we can understand it fully. And to that point, we were just talking about social media in suicide risk a number of years ago and still getting a grasp on that. But I see the two as being interconnected in this way. So just as I would recommend for parents and friends and close family members of individuals who are, if you're concerned about someone having a suicide risk, feel comfortable to check their social media, not necessarily as a way to check up on them or to spy, but really just in terms of, if you see someone has 10,000 friends online, but they have one friend in real life, that's a concern. Right? In the same way, if someone is spending an inordinate amount of time interacting with technology and not with the real world, if you will, then that's a concern. Whether it's artificial intelligence or whatever the platform is, it is also really important, I think, to build social connections whenever possible.
It sounds like you're saying the chatbot is in some sense a symptom. The underlying challenge is social isolation, not to take away from the problems with chatbots, but to think a little bit bigger in the first instance.
That's exactly right. The use of the chatbots is really, in many cases, a result of not having the real world social connections. And so as they become more regulated, as they become much more investigated in terms of the breadth of what they can do, we really have to be careful and safe. We have to be proactive in how we're protecting ourselves. And that goes for young people, and that goes for all of us.
Do you think part of the discussion with someone about their social media use now has to include, are you having conversations about how you're feeling with chatbot, with an artificial intelligence agent, so that maybe someone who cares about them can take a look and make sure that you're not in a, harm's way because of the way the conversation is going.
I think this is definitely something that parents may want to think about with children, for sure, just to kind of monitor social media and online activities to begin with as a baseline. I also think if there's concern with other people in your life, whether it's a family, a member, or peer, it's a worthwhile conversation if there's a feeling about it. And I say, even if you don't have any concrete evidence or concrete experience with someone turning to a chatbot for support, be willing to ask the question.
You said something earlier. You said, as these are more regulated. I don't know that I'm holding my breath to see whether these will be more regulated. It doesn't look like that's going to be happening, at least in the near term. But it raises the question, should they be? Should there be more attention to whether these tools are giving good information? Like, you need to call 988, or have you considered calling 988 instead of the kinds of dangerous messages that these conversations can wind up delivering?
I'll leave that decision to the larger decision makers about regulation. I do think that there is important, because it is a public health issue, in my opinion, in terms of when people, whether it's going to Google or a search platform or search engine or even artificial intelligence, in terms of the information access, we are no longer in the information age. We're in the digital information age. And so therefore, I think that there's probably some shifts that has to happen with the rules that kind of oversaw a lot of this 20 years ago. Today is very different than 20 years ago.
Let me ask you this last question, since it is Suicide Prevention Month. What risk and warning signs should people be on the lookout in their friends, family members, others, that are important to recognize and then take some of the actions we've been talking about?
Absolutely. So there are a number. It can range from anywhere from risk factors to, like I said earlier, people losing their stability in housing. They're losing relationships that they once were very strong in or held a lot of connection to. Loss of relationships are really big ones, especially for college-age students, but for all of us. And so if someone has lost a loved one, a pet even, had a different relationship or lost a connection with a trusted counselor or teacher or even a friend. Maybe in and of themselves, a singular loss may not be an indication of suicide risk, but clustered together, there could be something you want to follow up on. Also, I think is really important just in terms of people giving away prized possessions, people talking about not wanting to be here, even in a passive way. It doesn't have to always be explicit, I want to die, right? But it could be, my family would be better off without me, something like that. I think some warning signs just to keep in mind if people are thinking about harming themselves or killing themselves, look to see if they actually have the methods and means. You may want to ask or find out, does the person have a gun? Do they have a gun with bullets in the house? Do they have a history of a prior suicide attempt? Because we know people who have prior suicide attempts may not always, but sometimes it can indicate a future suicide attempt.
Mm-hmm. And if somebody is really worried about someone, but that person is resistant, the person who's worried can still call 988 and talk it over with someone. Is that right?
Absolutely. Absolutely. And they should. And I would encourage them, as I said earlier, be willing to risk being incorrect, right? Because it could sometimes turn out to be something else. The person wasn't suicidal, but maybe they were just having a bad phase, right? Because maybe they got poor grades or they were having some financial troubles. It may not have risen to that point, but risk caring enough to be wrong.
Dr. Walker Tisdale, thank you so much for all of your work in your career on suicide prevention and for coming to talk with us today.
Thank you, Josh.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.